Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today our topic of discussion is about the excessive use of mobiles and digital devices in children and its effects on their vision. How these children are developing short-sightedness, and after developing this short-sightedness, what are their possible complications? Nowadays, we are facing more and more children in our clinics who are using glasses, spectacles, and they are suffering from short-sightedness, or we call it myopia. It is a normal phenomenon that as children grow up, their eye also grows with their body. Like all body parts are undergoing modification, so it also develops and grows. But what happens wrong when this growth of eyeball is excessive? And this is the main cause, which we call the axial length. The eyeball gets stretched, and when it stretches and elongates, the child develops short-sightedness, excessive elongation. He needs glasses, and if it continues beyond a certain limit, all the structures which are present inside the eye also come under stress. I'm talking about retina. I'm talking about the filtration system in the human eye. So these patients who develop high myopia or high short-sightedness, I mean their power is more than -6, they are prone to develop complications. And as it continues the length, more and more problems, like they can develop degeneration in the retina, they can develop retinal detachment, they are more prone to develop glaucomas, they have a tendency to develop cataracts in the later life. So all these things are complications and side effects of high myopia, or I should say high short-sightedness. The changes have developed so much because of the stretching. So why we are discussing this point today, that we have observed and found a strong association between the development of this myopia and use of mobiles, digital screen. What happens when children use digital devices for hours and hours? Or even if we say that they do near work, extensive for hours, certain substances are released from the retina which affect the posterior 3 layers of the eyeball, that is sclera, choroid and retina. Eye undergoes modification and lengthening process. And because of this lengthening, to certain extent it is okay because the child is growing. But after that certain limit, when it grows, it causes pathological side effects. So this is very important in its development. The children should be encouraged to go into outdoor activities. I remember that when we were children, we used to spend a lot of time in outdoor activities, playing football, track and field, hockey, cricket. All these games not only contribute to the physical health, but also to the eye or ocular health. But now even the children play games on the tabs and digital devices. So this thing, which I am saying, contributes to their poor eye health. Children develop short-sightedness, and then later on their associated complications. So what we can do to control this abnormal growth of eyeball, which we call the axial length? we have to control the screen time of the children. Up till 2 years of age, it has been recommended that children should not use any digital device, mobile phone, iPad, like this, up till 2 years of age. From 2 to 5 years, they can be allowed to use 1 hour per day. And from 5 to 12, they can be maximum allowed time is 2 hours per day. These are the general guidelines and recommendations. To prevent elongation of eyeball and ultimately controlling high myopia and its side effects, which I have earlier mentioned. There is another rule, very effective to remember, that is 20, 20 and 2. According to this rule, if children are using and doing near work, it is basically near work which makes the problem. So after every 20 minutes of near work, the child should have 20 seconds break. And that near work must be more than 33 centimeters. Some children keep books very close to the eye. This is wrong. This is absolutely wrong. Minimum safe distance is 33 centimeter plus. They should be encouraged. It is the duty of teachers and parents to let them know and tell them that they should maintain proper distance of the books and notebooks, 33 centimeter more. And even then, after every 20 minutes, they should have 20 seconds break, and in this 20-second break, they have to see at a distance place as a distant object, so that cycle of near activity is broken. So this is 20-20 rule. And now the third part of this is that the children, as I mentioned, everything is growing in the eye, things are happening. They should go for outdoor activities daily for at least 2 hours. It is very important. The reason is that in spite of putting all the artificial lights in the room, we cannot attain that type of light intensity which is outside. And that outside light, atmosphere, focusing at distant objects is very important for the health, growth and development of the eye. So every child should have at least 2 hours of activity going parks, outside, so that their eye undergo the process of growth, of natural growth. Whenever these patients come to us, we go a thorough examination, we check the eye, its vision, all these things. And in children, we do glasses checkup after putting dilating drops to break spasm, to get the proper reading. And what happens, that many times the children don't know, and they are using their eyes with poor refractive errors. So what happens, that the brain is getting poor image from one eye. For example, if refractive error in one eye is, for example, I say -4, -5, and the left eye is -3. So the right eye becomes lazy eye, and children keep on using, and this lazy eye sends poor images to the brain. And when that definite period, which we call critical period, passes away, for example, if we come to see these patients after 11, 12 years of age, and his one eye is weak more than the other eyes, so that eye, for example, I told -6, -5 diopters, it becomes lazy eye, because the vision is being developed in the brain, and in the brain irreversible changes happen which cannot be controlled after 12 years, 13 years of age. Eye structure will be perfectly normal, everything, but the child has developed lazy eye, amblyopia. So this is another complication which happens. But as I was talking about earlier, myopia, short-sightedness, and near work, the earlier guidelines were which we can do ourselves. In many countries, it is mandatory for children to have outdoor activities, very important. But there are some treatments which can be done by trained people, which we call doctors of optometry, who prescribe glasses, contact lens, prisms, all these things. And one of the treatment modality is to use atropine eye drops under the close supervision of physicians and optometrists. Age-controlled graphs have been developed in boys and girls, children, and if the eye length, which can be easily calculated by ultrasound available devices, if the axial length of that child, male or female, according to the chart, is more than 75th percentile, more than that, then it is suspicious. So optometrists who are trained in this field, they start weak atropine eye drops, very weak strength, so that it does not have its side effects, but it helps in controlling the axial length. Apart from this, polychromatic glasses are also advised, in which near vision aids are added. So the child uses glasses for distance and near simultaneously. But these things which I am talking about, the medicines and glasses, these are under the expert supervision. But as far as we are concerned, we encourage the 20-22 rule to the children and tell them its significance. And especially with current lifestyles, the things are changing. We are having more and more patients who are developing myopia, and it is, of course, there is genetic association. We cannot deny it, but current lifestyles and poor reading habits and lack of outdoor activities, all these things are contributing, which can be controlled. And this way, the growth of eyeball, the lengthening of the eyeball can be managed, which will help us ultimately in controlling the myopia. I want to thank my respected audience for their attendance and attention. I hope today's presentation, brief one, about the side effects of extensive use of digital devices, particularly in children, this presentation will be beneficial, and I want to thank for your attendance and attention. Thank you.